The number one question that I get from most moms is, am I allowed to fire my care provider? And you absolutely are. And this, for a lot of women, is one of the most uncomfortable things they have to do during pregnancy. Again, if they have a care provider that they don't feel aligned with. Because the thing is, our society has set doctors up to be like gods. And a lot of times that's actually good because we do end up having a lot of trust and faith in them. And 99% of the time when we're going to the doctor or the hospital, we are scared, we are needing medical treatment. And it's really great that we have that trust in doctors because a lot of times that trust helps to calm us down. But during pregnancy, we're not sick. We just need somebody there in case something does happen. And so it's this different kind of relationship with the doctor in that situation. And with pregnancy, it needs to be more of a collaboration than just having somebody that tells you what to do. And a lot of care providers, especially with pregnancy, they present opinions like facts. Not all of them. There are amazing medical care providers out there that support pregnant women. But, like, for example, I just had a mom who said that her care provider told her that inductions at 39 weeks reduce the chance of a C-section. I don't think that's a fact. So a lot of women hear statements like that. And of course, the doctor is presenting it like it's gospel. And it can be really uncomfortable and it can make them feel like they're stupid. You know, I've had moms say, my care provider, when I talk to them about my preferences, they make me feel like I know nothing. Like, psh, throw your preferences out. I know what you need to do. Like, you're not a doctor. Go home, little girl. And that infuriates me. You know, with pregnancy, there are so many ways that we can feel empowered and we can bring our own beliefs and preferences into the experience successfully. So, if you have a medical care provider and you don't feel comfortable asking them questions, and you bring them your birth preferences and they roll their eyes at you, or they make you think like whatever your plan is not going to work out, again, just listen to me. If you don't intuitively feel good with them, you deserve to give yourself and your baby a care provider that you connect with, that you trust, that you feel comfortable expressing anything and everything to. So, if you find that that's the situation you're in, number one, realize, because I know nobody wants to offend somebody else, you know, it makes us uncomfortable, right? I promise you, you will not be the first person to leave that care provider. You won't be the last person. And they probably could care less. That's no offense to you, but they probably have tons of clients. It's no sweat off their back if you go find somebody else. So usually it's a much bigger deal in our own heads than it is to them. So to find a care provider that you actually connect with, number one, I recommend talking to friends that you know, friends or family members that had a birth that you connect with. You know, it sounds like their care provider is somebody that really supported, again, the type of birth that you're hoping for. If you're taking a childbirth preparation class, a lot of times those educators have care providers that they can recommend. And initially, I would do some phone calls, you know, with these different clinics or midwives or whoever it is that you're wanting to interview. Just do a quick call. Number one, see if they're, you know, accepting new patients. Of course, you can see if they accept your insurance. You can take care of those nuts and bolts first and foremost to make sure that it's practical to go to them. And then you can ask them, you know, what are your philosophies on birth? This is the type of birth I want. How do you feel about that? And if that initial conversation is good, and you feel like, all right, this could be a good fit, go and see them in person and then have that discussion, but more in depth, and really pay attention to their facial expressions and their responses. You know, if you're talking about the type of birth you want, they're like, well, yeah, you know, we can try to do that, but we'll see. I haven't seen that work out very often. You know, if they're really hesitant to support what you're wanting, that might not be a great fit. And sure, some of us have special circumstances that require medical intervention. So I'm not saying that, you shouldn't listen to them if there is something very real going on in your situation that requires specific medical support. But if they're just like, yeah, like I really don't think you're going to go into labor without an induction. Or it's something, it's like, how do you know? So intuitively, like really tune in to how that person's making you feel, and fingers crossed that you will meet somebody, have an interview with somebody that makes you feel really good. And like, yes, I can have this kind of birth, and actually enhances your sense of empowerment and confidence instead of siphoning it out of you. And if you're worried that you are really close to your due date and you have a care provider that you don't like, know that it is not too late. I had a mom that switched and got a midwife the day that she went into labor. I had another mom who was scheduled for a C-section because her baby was breech. And a week before that C-section, she decided, you know what? I want to find a care provider that will deliver a breech baby. She found that care provider. She had a beautiful breech delivery. So you can switch care providers at the last second if you need to. So again, just remember that you are not their patient. You are their client, and you deserve to feel good with them. You deserve to feel excited to go and have an appointment with them, because you're like, all right, cool. I'm going to have a really great discussion about pregnancy and childbirth. I'm going to feel supported. You want to feel good walking out of that office, not scared and doubtful of yourself and your abilities to birth your baby. I hope this helps. I'm totally happy to offer guidance if you are navigating this process right now and need somebody to cheer you on. I'm here to do that. My email address is below, and of course, you can also leave comments.